Imagine waking up one day with what seems like just another stomach ache, something you brush off as indigestion. You go about your day, ignoring the discomfort, until days turn into weeks and the pain doesn't go away. Over time, fatigue sets in, and you notice subtle changes in your body. Weight loss, changes in your bowel habits, maybe even blood in your stool. You assume it's stress or a minor infection, but what if your body is trying to warn you about something much more serious? Colon cancer doesn't announce itself loudly. Instead, it creeps in silently, revealing itself through subtle warning signs that many people overlook. Colon cancer is one of the most common cancers worldwide, but the good news is that it is highly preventable and treatable when caught early. The key to survival is awareness. Your body gives you clues, signals that something isn't right. Recognizing these signs early can mean the difference between life and death. In this video, we'll explore these warning signs, explain why they happen, and discuss what you can do to lower your risk. Before we dive in, make sure to subscribe to the Public Health Room so you never miss crucial health insights that could save lives. One of the earliest warning signs of colon cancer is persistent changes in bowel habits. If you suddenly experience diarrhea, constipation, or a change in the consistency of your stool that lasts for more than a few weeks, it's a sign to take seriously. Occasional changes are normal, but when they become persistent, they could indicate something affecting your digestive tract. Colon cancer can cause the colon's lining to become inflamed or blocked, leading to irregular bowel movements. Another significant warning sign is blood in the stool. Many people dismiss this as hemorrhoids, but rectal bleeding, especially dark or tarry stools, can indicate internal bleeding from the colon. The bleeding may be intermittent or continuous, but any unexplained blood in the stool warrants immediate medical attention. A real-life case involved a man in his early 40s who ignored minor rectal bleeding for over a year. When he finally sought medical help, he was diagnosed with stage 3 colon cancer. Had he recognized the warning signs earlier, his treatment options would have been far less aggressive. Unexplained weight loss is another red flag. If you are losing weight without trying, despite maintaining your usual diet and lifestyle, it could be a sign that your body is struggling with an underlying condition. Colon cancer can cause a loss of appetite, increased metabolism from fighting the disease, or blockages that make digestion inefficient. A study published in the Journal of Clinical Oncology found that unexplained weight loss is a common symptom in patients diagnosed with gastrointestinal cancers, including colon cancer. Fatigue and weakness often go unnoticed, but are crucial indicators. Colon cancer can cause chronic internal bleeding, leading to anemia, a condition where the body lacks enough healthy red blood cells to carry oxygen. This results in persistent tiredness, dizziness, and shortness of breath. If you feel unusually fatigued for an extended period without any obvious reason, it's worth discussing with a doctor. Abdominal pain and cramping that don't resolve could be linked to colon cancer. While mild digestive discomfort is common, persistent pain, bloating, or a feeling of fullness that doesn't go away can indicate something more serious. Tumors in the colon can cause partial blockages, leading to discomfort and pain, especially after eating. A constant feeling that you haven't completely emptied your bowels, also known as tenesmus, is another warning sign. This occurs when a tumor partially blocks the rectum, making you feel like you still need to go even after using the restroom. Iron deficiency anemia in older adults without an obvious cause is another potential red flag. If routine blood work shows low iron levels, doctors often investigate gastrointestinal causes, including colon cancer. Since slow internal bleeding can go unnoticed, anemia might be the first noticeable sign of the disease. A narrowing of the stool, often described as pencil thin, can be a symptom of colon cancer. If a tumor is obstructing part of the colon, stool may struggle to pass through normally, leading to a change in shape. Nausea and vomiting, particularly when persistent and unexplained, can also indicate an obstruction in the digestive system. While occasional nausea is common, frequent bouts that don't seem related to food poisoning or infections should be taken seriously. Finally, jaundice, a yellowing of the skin and eyes, can be a late-stage sign of colon cancer that has spread to the liver. This is a serious symptom that requires immediate medical attention. Understanding these warning signs is the first step, but prevention is just as important. Lifestyle choices can significantly lower your risk. Eating a diet rich in fiber, whole grains, vegetables, and lean proteins while limiting red and processed meats can help keep your colon healthy. Regular physical activity, maintaining a healthy weight, and avoiding smoking and excessive alcohol consumption also reduce risk. Screening is one of the most powerful tools against colon cancer. Colonoscopies and stool-based tests can detect cancer early, often before symptoms appear. The American Cancer Society recommends regular screening starting at age 45, but if you have a family history or other risk factors, talk to your doctor about starting earlier. If you experience any of the symptoms discussed, don't ignore them. Early detection saves lives. Colon cancer is treatable when caught early, and there are many effective treatment options, including surgery, chemotherapy, and targeted therapies. The most important thing you can do is listen to your body and seek medical advice when something feels off. If you found this video helpful, give it a thumbs up, share it with your loved ones, and subscribe to the Public Health Room for more life-saving health insights. Your health is your greatest asset. Stay informed, stay vigilant, and take charge of your well-being today.